I'm Andrea Klein-Thomas. ISPOR is driving transformative changes in health and well-being, especially when it comes to HEOR. For more on its impact on whole health, we begin our discussion with Charlene Wong.
I think about whole health as the many different factors that influences a person's or a community's health. We think about their physical health, their behavioral health, their socioeconomic health, and even their spiritual health.
Why is it important for HEOR to join this journey from patient to person?
In order to support whole health, we have to think about people as people. They are beyond what you can see in the electronic health record or administrative healthcare data. It's about all the things that happen to them both inside of a clinic and outside of a clinic that impacts their health and well-being.
Why is it important for HEOR to join this journey from healthcare to health?
When we think about all those different factors that influence health, it actually turns out that most of what influences health happens outside the four walls of a clinic or a hospital. That's why when we're thinking about the systems that are meant to improve health and protect lives, we have to be thinking about health beyond the four walls of healthcare.
And how will metrics and measurement play a role in this journey?
We can't solve for problems that we can't see. When we think about whole health, there is much to be measured than what we traditionally measure in health economics and outcomes research. It's not just healthcare utilization, healthcare cost. It's things like unmet social needs that impact people's health. It's things like what's going on in the community, what are the stories that people have to tell that will really help us understand how we impact and improve their whole health.
We continue the conversation with Ana Paula Beck-da-Silva-Etkes. What kinds of linkages do we need to create to orient healthcare to whole health?
Okay, so I think that something very important is to decide the objective we have when we are using data sets. So if you want to better understand PROMs, for example, during a care pathway, this is our goal. So let's organize the data for only this objective. Sometimes I see people trying to do very strong linkage without an objective. At the end of the day, you have a lot of data, but you don't have an answer. So I will start by defining well an objective and focusing on that. And after that, we can have another one. But break down in a few phases, it will be a path that I will recommend.
Thanks for joining us. I'm Andrea Klein-Thomas. For more key topics about issues in healthcare, go to our website, ispor.org.